talk about the GFR, and actually I would like to teach you an easy way how to calculate GFR, renal plasma flow, and filtration fraction as well. Very simple way. Let us start with the main concept. If you know this main concept, everything will be easy. I draw this diagram to tell you we have three major functions in our kidney for every single substance. We have filtration. You see blood is coming through the efferent, the capillary, and efferent is going back. Here it will be filtrated, but it's not the only things. We have two more things. Sometimes after filtration, still we have secretion of the substance, like substance A, like glucose, like potassium, sodium, water, whatever. It's secreted to the tubule and of course going to the urine, or sometimes after filtration or secretion will be reabsorbed. That means we have three major functions: filtration, first, secretion, and reabsorption. Combination of these three make how much of substance A will be in urine. Basically, concentration of substance in urine depends on these three, which, as you know, for some substances, these is only related to filtration. That means there are not that much secretion and not that much reabsorption. And we use those to calculate filtration of glomerular. Why? Because if we cannot calculate how much secretion or reabsorption, if the secretion and reabsorption be there, it will be very complicated to calculate how much is the glomerular filtration rate. That's why we use some substance which only will be filtrated. Of course, not 100% all the time, but nearly 100%. After this briefing, let me talk about blood to the kidney. You know, everything must go through this blood system. We have two different blood systems. From the renal artery, when it comes to the kidney, kidney is an organ and as a tissue and needs to be alive. For that, that's why we have inert tissue supply. The blood from the renal artery supply the kidney as an organ. However, because the kidney has to do this function, the part of blood, which is a lot of that, we call it goes to secretory tissue, which is combination of nephrons and the tubules. All of this make urine production. This is correct. After knowing this fact about how blood is distributed in our kidneys, let's talk about how we calculate renal plasma flow. At the end of this short lecture, I will give you a few examples, and it will be very easy for you to calculate GFR, RPF, and others. We use a substance, as I said, need only to be filtrated, no secretion, no reabsorption, like pH. We consider that whatever we enter to the kidneys, pH entry is equal to living kidney. Oh, this is one fact, of course. And as a result, that means there is no more metabolism, only whatever is going in is coming out. For entering kidney, we have of course, the level in the artery with how much blood or plasma is going to the kidney. Of course, after artery, we have, in the exit, we have vein and urine, as I told you, two supply, vein and urine. And with very simple calculation, because this is the renal plasma flow in two blood vessels, artery and vein, if you bring this one here and simplify this formula, you will reach this. The level of the pH in urine times volume, that means the rate of the urine, and divide by P of pH in artery minus vein. That means concentration of pH in artery minus vein. However, Normally, roughly we consider in the vein there is no PEH. That means you can say this is equal to 0, and as a result, renal plasma flow is the concentration of PEH in urine times the rate of urine, for instance 5 ml per minute or whatever, divided by concentration of PEH in our blood, which is artery. Let me make it very simple, because this formula will be used somehow for GFR as well. It's simple like that. Imagine you have income $100 per day. $100 per day, and you have 3 meals per day. Or for one meal, you spend $10. For instance, for breakfast, you spend $10. Tell me, the ratio of the money you spend for your breakfast is 10 divided by 100. 10% of your, this is the ratio. True? It's like a urine is output and artery is coming. Artery is income and urine is exit. And what is V is the how many times, like as I said, you spend $10 for breakfast. If you spend $10 3 times per day for lunch and dinner, what do you do? 10 times 3 divided by 100. That means 30% of your money per day you spend for your food, for your meal. Okay, simple, exactly like that, because it's a ratio. Very simple. If you have the concentration of pH, then in the artery and urine, and of course the rate of the urination, how ml per minute, you can calculate renal plasma flow. I give you some example at the end. Don't worry about that. Next, before I explain how to calculate clearance and GFR, I have to tell you about the main concept of GFR. In this diagram, you will see we have glomerular and capillary efferent and efferent, and here is the Bowman's capsule. That means blood is coming here and will be filtrated to this system. For make it easy, I draw these two lines. This side is your artery, this side is your tubules. In each side, we have some pressure. For filtration, you need pressure. In each side, we have hydrostatic pressure, because the volume of blood or here plasma definitely has pressure in that area. All right, as I said, I draw this diagram to make it easy. In each side, for filtration, you need force. What type of force? That means the fluid is here and here. They have pressure. We call it hydrostatic pressure. Here we have tubule. We call it hydrostatic pressure of tubule. Here, hydrostatic pressure of glomerular capillary. This side. Do not try to memorize this formula. Try to understand. In these two sides, what we have? Capillary, we have tubules. Of course, here we have hydrostatic pressure. The fluid is coming, plasma is coming, or blood. Okay? This side of tubule is not empty. There are some fluid as well. That's why it has its own hydrostatic pressure. Hydrostatic pressure, that means the pressure is pushing fluid outside of lumen, capillary or here. That means these two pressures are against each other. PT and definitely the balance between these two makes how much fluid are moving from capillary to glomerular. However, it's not the only pressure. We have protein, for instance, which causes colloid osmotic pressure. What does it mean? Hydrostatic pressure is going this way, from capillary to lumen, from lumens or tubules to capillary, against each other. What about oncotic pressure? Oncotic pressure in each side is against moving fluid, because the protein wants to absorb fluid. That's why the capillary part, oncotic pressure or colloid osmotic pressure absorb the fluid. That means it's against filtration. And the opposite, in the tubular part, protein want to absorb most fluid. That means it's um, helping filtration. As you can see, two forces are making filtration easier, and two forces are against in each side. Here we have hydrostatic pressure is helping filtration. Hydrostatic pressure opposite over there is against. Here we have oncotic or osmotic colloid pressure against filtration. This side of tube helping. As a result, these two are positive, these two are negative against filtration. Balance between these four pressure help us to measure how much filtration we have. Even, for instance, your hydrostatic pressure is very high in here, what will happen? Definitely your GFR will increase. Or your oncotic pressure here is very low. What will happen? GFR will increase. If hydrostatic pressure here will be higher for any reason, what will, like obstruction of the urine pathway, what will happen? The pressure will increase, hydrostatic pressure is increased, GFR will decrease. Or if we have more protein here, what will happen? More protein absorbing more water, GFR will increase. That's why in each side we have always positive and negative force against filtration. And balance between these four help us to understand how much GFR we have. I hope you understood this one very well. If you understood this concept, you can tell me which variable influenced GFR. If I tell you this this hydrostatic pressure, definitely. This oncotic or osmotic colloid pressure, yes. Permeability, definitely. It depends how thick is this layer. And renal blood flow, definitely. When renal blood flow is higher, definitely maybe it affects this pressure as well, and many other. After knowing what is the concept of the GFR, the balance between these two pressure, let's talk about how we calculate GFR, and before that, clearance. Clearance is exactly like what I said about how to calculate this one. I back to my example, clearance of creatinine, clearance of money. For that example, I told you clearance of money from your pocket was $10 per meal. That means here, exit. And how much you had? $100. How many times? 3 times. Same things for kidney. We are giving something to kidney. For instance, creatinine is going to kidney via way, blood. Artery, creatinine going to kidney. And what is happening? Part of that creatinine, a portion of that creatinine goes out of the kidney and the body system by urine. Then how do you calculate? Okay, how much is that? Per 1 ml, of urine, how much is that? For instance, 0.1, for instance. And then V, you must calculate, you must know how many ml per minute. Yeah? Like how many meals per day. Very simple. Always remember, when you want to calculate the clearance is how much you are giving out and how much is in output, divide by input. Same thing for GFR. For instance, if the substance only will be filtrated, there is no secretion and reabsorption, you can use that substance, clearance of that substance will be equal to GFR, glomerular filtration rate, which in our body, although it's not 100%, but we use creatinine because instead of giving something like an inulin to patient, we use something which our body is producing, like creatinine. It's much easier. It's not 100% accurate, but it's better than doing some extra test. Clearance of creatinine, how do you calculate? how much creatinine per 1 ml of urine times how much urine per minute, for instance 2 ml per minute, just an example, divide by what? Divide by the concentration of creatinine in plasma. Again, concentration of the creatinine in plasma, that means it's input to kidney. Here is output. Always for GFR or clearance, you must divide output over input. Input is coming from plasma. You need concentration in plasma. Output is from urine. And of course, you have per 1 unit of urine, which is 1 ml, you have to multiply it by how many ml per minute. That's why we have a V here. Okay, let's move for one more step. After that, I give you a few examples. All right. Now, 2 more things before I go for some examples. I taught you about renal plasma flow. But you know, the plasma is portion of blood, which is, you know, if blood and you divide it 2 portion is blood cells and plasma. Blood cells mostly is RBC platelet and white blood cell are not that much. That's why you can see hematocrit and plasma together will be amounts of blood, true? And that's why when you calculate renal plasma flow, sometimes you can calculate renal blood flow as well. I will give you some example. Very simple, because you calculate renal plasma flow based on pH. I told you how much pH in the urine or output over input in artery. Now we use this simple fact, which is blood flow. 1 minus hematocrit, it means how much plasma is. For instance, 60% of blood is plasma. 0.6 times blood flow will be plasma flow. Always the portion of renal blood flow is, but mostly is nearly 60%. But in different examples, they can give you 55%, 50%, 65%. They can change with that number, but it's very simple. 1 minus hematocrit is how many percent plasma we have times. Of course, for hematocrit, we don't use percentage. For instance, if they said hematocrit is 45%, but we put 0.45. And here we will reach 0.55 times RBF will be RPF. We can calculate RBF from RPF or opposite. The next, which is very important, is filtration fraction. It's a fraction. That means you calculate the ratio of how much filtration you have over how much plasma is filtrated. Not all plasma will be filtrated, all of them is going out through the tubules and the kidney and urinary system. That's why we have filtration fraction, which is very simple, ratio of GFR over RPF. Do not memorize it. Filtration fraction, that means your always output must be over input. Plasma is going in its input to glomerular or to kidneys, and GFR is your output. Always output over input. Okay, let's give you some example. First example. Imagine you have a case, your patient's urine volume is 1,440 ml in 24 hours. Okay, first point. It's amount of blood, it's amounts of urine in 1 day. We need 1 minute. Remember, for calculation of GFR, you need 1 minute. Simple. 24 hours, you divide 24 hours. Each 24 hours is 60 minutes. Always calculate per 1 minute. If they give you 1 hour, divided by 60. If 1 day, 60, of course, times 24 is 1,440 will be 1. If they give you 10 hours, of course, 10 times 60, 600. Calculate for 1 minute. And concentration of the creatinine in the urine is 0.9 milligram ml for this patient you calculated, or actually they gave you this information. Okay, now you have the output part, how much urine per minute and how much the concentration of the creatinine in the urine. One more information you need, what is that? Plasma, concentration of creatinine in plasma. Here they give you 0.8 milligram, imagine 100 ml. As I told you, here you need milligram and 1 ml. 100 ml is too much. You have to divide this one in to calculate for 1 ml. If you in 100 ml you have 0.8, definitely for 0.8 divided by 8 you have 0.008 milligram per ml. 1 milligram, remember 1 ml here, 1 ml for urine. Same unit, same unit. Now you can calculate. What I said, GFR, out, in. Always out over in. What we have in output, how much is concentration of creatinine in urine, and how much urine per minute the kidney is producing. 1 ml per minute is producing. In 1 ml you have 0.9. This is your output. And input, how much creatinine in 1 ml plasma is this. If you calculate it simple, 100 nearly 12 is your patient's glomerular filtration rate. Remember, is rate out over in. I give you next example. Okay, in this example, I am going to give you two questions. First, again, the urine volume for this patient is 2,160 ml per day. What I say is day. You have to calculate per minute. 2160 over. How many hours per day? 24. How many minutes? 1 hour? 60. Which is 1,440. This simple calculation, that means 1.5 ml per minute. It's the amount of urine this patient is producing. Second, concentration of creatinine in the urine, which in this case is 0.6 milligram per ml. Milligram and milliliter. No calculation or simplifying because milligram and milliliter we need. But the question is, number of creatinine appear in urine each minute. In this case, they didn't ask about the clearance. That's why they didn't give you the concentration in the plasma. Only they ask you how much number of creatinine. Simple. It's asking about output. How much creatinine? Very simple. Exactly. I back to my example. 1 meal, $10. 3 meals, 3 times 10 as our output. 0.6 milligram per ml. That means 1 ml of urine, 0.6. 1.5, how many? Simple. 0.6 for 1 ml. We are producing, this patient is producing 1.5 ml. That means per minute this patient is removing 0.9 milligram creatinine. Simple like that. Remember that simple example. 1 meal, $10. 3 meals, $30. 1.5 meals, for instance, is possible. 10 times 1.5, 15. Here, 1 meal is equal to 0.6. How many times? 1.5 divided with B. Okay, now I give you the second part of this question. Alright, in the first example I give you two data, which was concentration of the creatinine in urine, which was 0.6, and how much urine per minute is producing. Then I ask you output, which was the number of creatinine in each minute. this times this will be number of creatinine. Simple. You know that. In this example, I didn't give you PCR. That means the concentration of the creatinine in plasma. If I give you that, I can ask you about the clearance of creatinine, which I did. I give you 0.6 milligram in 100 ml. Again, alarm, 100 ml. You must calculate for 1 ml. Definitely you divide this by 100. You will reach 0.006 milligram per 1 cc or ml. Now you have all three information, 2 for output, 1 for input. For output, you have clearance, the concentration of creatinine in urine. You have how much urine per minute. And here you have how much of creatinine in plasma. Then simple, you will reach clearance of creatinine is 150 ml per minute. This is very simple calculation. Next, go for the next example. Okay, next example, I give you urine flow rate 180 ml per hour. Again, per hour. What you're supposed to do is to calculate per minute. 1 hour is how many minutes? 60 minutes. 180 over 60 will be 3 ml per minute. And I give you the concentration of inulin, which you know the inulin, the substance, 12 milligram per ml. Do we have to change this? No. Milligram and milliliter. And concentration of inulin in plasma, I give you 0.25 milligram per ml. No need to change again. Milligram and milliliter. Always pay attention to the units. Okay, now I ask you clearance of inulin by this patient's kidney. Clearance out over in. What is out? Of course, concentration in urine. How much urine per minute? Concentration is 12. How much per minute? 3. The concentration in plasma, which is our input, is 0. Simple calculation. Clearance of inulin in this patient is 144 milliliter per minute. Next example. Alright, in this example, I want to give you some more calculation. It's very simple. Please don't think it's going to be very complicated. Again, in this case, I give you the concentration of PAH in plasma, 2 milligram per 100 ml. What you're supposed to do? 1 ml exactly. 2 divided by 100 is 0.02 milligram per 1 ml. Concentration of PAH in the urine, I gave you 6 milligram per ml. No need to calculate anything because it's milligram and milliliter. Urine flow rate, I give you 2,880 ml per day. 2,880 cc per day. What we need per 1 minute. 1 day, 24 hours. Each hour, 60 minutes. That means you divide this by multiplying 24 times 60. You reach 2 milliliter per minute is your V. Now, I ask you first question. What is the clearance of PAH in this case? Out, in. Out is UPH times volume per minute, 6 times 2, and concentration in plasma. You have 600 ml per minute is clearance of pH. Very simple, like any other. Remember, output over input. For the output, do not forget, you need concentration in the urine plus how much urine per minute. For the plasma is one number. Second question I ask related to this case, I ask you if 10% of pH not excreted. Always you remember, initially I told you, we consider normally 100%, but it's not always. They can give you the case and say, for instance, 10% is not excreted. That means how many percent is excreted? 90%. And they can ask you, what is the renal plasma flow if 10% is not excreted? Back to that fact. Normally we consider renal plasma flow is equal of plasma concentration renal plasma flow is equal to concentration of clearance of pH. True? Okay. If everything is okay. But in this case, I said 10% is not excreted. That means 90% of renal plasma flow is equal to concentration, clearance of pH. You have the clearance of pH was 600. Of course, divide by 0.9. This one comes here. You can calculate how much is renal plasma flow. That means 667 is a renal plasma flow, which 90% of that, based on that, of pH will be clear with that, not 100%. If it was 100%, whatever is plasma, renal plasma filtration, it's equal to clearance of pH. But if they said not, for instance, here I give you 10. If I give you 20%, is that excreted? That means 80%. 0.8 times, then you divide your clearance of pH by 0.8 and you calculate how much is renal blood. Very simple. Don't confuse yourself. Third question I asked about renal blood flow. What I told you, I said renal blood flow is very simple. Just you calculate renal plasma flow by multiplying renal blood flow times how many percent plasma we have. How do you calculate how many percent? 1 minus hematocrit. Here I give you, for example, hematocrit 0.5 is a high level of hematocrit, but just is a number. What do you do? 1 minus 5 is 1 minus 0.5 is 0.5. That means half of renal blood flow will be renal plasma flow. You have this number is 667. Then this number comes here, 0.5. You can calculate how much renal blood flow is that. Simple. You will reach 1,300 something. Last question. I'm not going to stop with asking question. Last question is simple way to tell you how many percent of our cardiac output is going to our kidneys by only using this example. I gave you cardiac output 5 liters per minute in the normal person. 5 liters per minute. And I asked you the fraction of cardiac output flows to the kidney. That means how many percent of this 5 liters per minute is going to our kidneys? Very simple. You know renal blood flow. How much blood going to kidney per minute. You know how much blood coming out of our heart is 5 liters per minute. Now I'm asking how many percent is going to kidney. Of course, the blood is going to kidney over blood is coming out of the heart. 1,300 something over 5,000. As you can see, it's around 0.26. And as you remember from the physiology, almost close to 20% of cardiac output going to our kidneys. This is one example to show you how, based on the cardiac output and renal blood flow, you can calculate. Remember, here blood flow, because cardiac output is not plasma, it's blood. And for calculating this, you cannot use renal plasma flow. You have to use renal blood flow. Simple. I brief it. When you want to calculate GFR, clearance of something like a clearance of pH, creatinine, inulin, you need 2 things, output and input. Input is whatever is concentration of that substance in plasma, and output is concentration of that substance in urine and how much urine per minute. Simple like that. Remember my example. 1 meal, $10. 3 meals, 3 times. Yeah? Your income is $100 per day. Your GFR, that means how much money is going out of your pocket per day, is 3 times $10 per each times. Divide by 100 is 30%. This is your money, GFR of your money from out of your pocket per day. Okay, this is very simple way to understand what is GFR. And other things, I have one more things about efferent and efferent and how these things will change, and also filtration fraction. I will add this one with the next lecture. At the beginning of next lecture, I will give you some example to review this and continue with the new chapters. See you in the next lecture.